Okay, go ahead.
Group members and reporters, please turn on your cameras while reporting.
Hello, myself Prima Gaur. Today's our topic is lymphatic filariasis. Next. Lymphatic filariasis is also known as elephantiasis, is a neglected tropical disease. Infection occurs when filarial parasites are transmitted to humans through mosquitoes. The painful and profoundly disfiguring visible manifestation of the disease are lymphedema, elephantiasis, and scrotal swelling. Occurs later in life and can lead to permanent disability. These patients are not only physically disabled but suffer mental, social, and financial losses, contributing to stigma and poverty. Next, etiology. Lymphatic filariasis is caused by infection with the parasites classified as nematodes, which are roundworms. There are three types of these thread-like filarial forms: Wucheria bancrofti, Brugia malai, Brugia timori. Wucheria bancrofti, which is responsible for 90% of cases; Brugia malai, which causes most of remainder of the cases; Brugia timori, which also causes the disease. Next. Host. Wucheria bancrofti, Brugia malai, and Brugia timori are considered human parasites as an animal reservoir are of minor epidemiologic importance or absent. Phyllid species and some primates are the primary reservoir hosts of zoonotic B. Brugia parangii. Next. Vectors. The typical vector for Brugia species filariasis are mosquito species in the genera Mensonia and Aedes. Wucheria bancrofti is transmitted by many different mosquito genera species depending on geographical distribution. Among them are Aedes species, Anopheles species, Culex species, Mensonia species, and Conquilititia juxta Mensonia. Next. Geographic distribution. In Africa, most common vector is Anopheles. In America, it is Culex. In Pacific and Asia, it is Aedes and Mensonia. Next. Wucheria bancrofti occur in sub-Saharan Africa, Southeast Asia, the Indian subcontinent, many of the Pacific Island, and focal area of Latin America and Caribbean. Brugia malai occur mainly in China, India, Malaysia, Philippines, Indonesia, and various Pacific islands. Brugia timori occur on Timor Island of Indonesia. Overall, approximately 2/3 of individuals infected with the lymphatic filariasis are in Asia. The epidemiology of lymphatic filariasis is changing due to implementation of the global program of mass drug administration to eliminate transmission. Next. Epidemiology. Next. In 2020, 863 million people in 50 countries were living in area that require preventive chemotherapy to stop spread of infection. The global baseline estimate of people affected by lymphatic filariasis was 25 million men with the hydrocele and over 15 million people with the lymphedema. At least 36 million people remain with this chronic disease manifestation. Eliminating lymphatic filariasis can prevent unnecessary suffering and contribute to the reducing of poverty. As I discussed, 90% of cases are due to Wucheria bancrofti, and while the remainder is due to largely to Brugia malai. Estimates suggest that as many as 36 million infected individuals are seriously incapacitated and disfigured by lymphatic filariasis. One study in India noted that patients with the chronic filariasis lose around 29 days of work per year due to complications of infection, highlighting the considerable burden the disease places on individuals and on community. Another study reported an estimated productivity loss due to lymphatic filariasis of 77 to 100% during attacks of acute dermatolymphangio identities, 10 to 26% for lymphedema, and 15 to 19% for hydrocele. In addition, data suggests that the prevalence of depressive illness is high, accounting for an estimated 5.09 million disability adjusted life years. Filariasis in the Philippines. Within the Philippines areas, endemic for lymphatic filariasis are in regions with the highest incidence of poverty. Out of 79 provinces, 39 have a higher poverty incidence than the national average, and 30 of these 39 provinces are endemic for lymphatic filariasis. Next. Okay, this is all my part. Thank you.
Clinical presentation. Next slide. Clinical manifestations. Manifestations are of two types. The first one is lymphatic filariasis, in which there is presence of adult worms, and second is acute filariasis, in which there is immunohyperresponsiveness. Next slide. Stages in lymphatic filariasis. There are 4 stages. First is asymptomatic amicrofilariamic stage. Second is asymptomatic microfilariamic stage. Third is stage of acute manifestation. And fourth is stage of obstructive, which is also known as chronic lesions. Next slide. Now the first stage of asymptomatic amicrofilariamic. Here the majority of infections are asymptomatic, showing no external signs of infection, but they contribute to transmission of parasite. These asymptomatic infections still cause damage to lymphatic system and kidneys and alters the body's immune system. Next. Stage of asymptomatic microfilariamic. Here there are considerable proportions are asymptomatic and for months and years, but they have circulating microfilariae, and they are important source of infection, and they can be detected by night blood survey and suitable procedure. Next. Stage of acute manifestation. These occur during initial month and year, and there are recurrent episodes of acute inflammation in lymph vessels, nodes of lymph and scrotum, and are related to bacterial and fungal superinfection of tissue that are already compromised, that has already compromised lymphatic functions. The clinical manifestation consists of filarial fever, lymphangitis, lymphadenitis, and epidemiology. Next. Now the last stage, which is stage of obstructive, which is also known as chronic lesions. This takes place for 10 to 15 years, and it causes permanent damage to lymph vessels caused by adult worms and pathologic changes causing dilation of lymph vessels due to recurrent inflammatory episode, which leads to endothelial proliferation, inflammatory granulomatous reactions around
Hello, Nancy. Hello.
Yeah.
Can you stop for a while because doctor left already?
Okay.
So she will join again, and then you can start.
Okay.
Hello, doctor. Are you there, doctor? Doctor?
Sorry, I got disconnected. You may proceed.
Okay. The last stage, which is stage of obstructive, which is also known as chronic lesions. Chronic or obstructive lesions take 10 to 15 years, and it causes permanent damage to lymph vessels, which is caused by adult worms, and the pathologic changes causes dilation of lymph vessels due to recurrent inflammatory episodes, which leads to endothelial proliferation and inflammatory granulomatous reaction around the parasites. So initially it starts with pitting edema, then it gives rise to brownie edema, and then leading to hardening of tissues. Still let hyperpigmentation, keratosis, and wart-like lesions are also developed. Example is hydrocele in 40 to 60% of patients, elephantiasis in scrotum, penis, leg, arm, vulva, breast, and chyluria. Next, diagnosis. Next. So the standard method for diagnosing active infection is identification of microfilariae in blood smear by microscopic examination. The microfilariae causing lymphatic filariasis circulate in blood at night, which is known as nocturnal periodicity. Therefore, the blood should be collected at night to coincide with appearance of microfilariae, and thick smear should be made, which is stained with Gemsa or hematoxylin and eosine. Patients with active filarial infection, they have elevated levels of antifilarial IgG4 in the blood. Next. Treatment. So there are two methods of treatment. First is medication, in which medicines are given like ivermectin, diethyl carbamazine, or albendazole, and these drugs destroy the adult worms in the blood. And for surgery, surgery is done to remove dead worms from the bloodstream. And if filariasis has caused hydrocele, then you may have to do surgery to relieve fluid built up in the scrotum.
So next is prevention and control. Okay, so the best way to prevent lymphatic filariasis is to avoid mosquito bites by sleep under a mosquito net between dusk and dawn, wear long sleeves and trousers, and use mosquito repellent on exposed skin. Next slide, please. So the next is WHO response. So WHO launched a global program to treat lymphatic filariasis in 2000, and more than 6.7 billion treatments have been delivered to stop the spread of infection since 2000. So the two key components of this strategy were, the first one was stopping the spread of infection through large-scale annual treatment of the people who were living in the endemic area. And the second one was alleviating the suffering which was caused by lymphatic filariasis by providing a basic package of care, that is the people who are already having chronic manifestations of the disease. So by providing them a basic package of care and improving the quality of life. So yeah, these were the two strategies. Next. So the first, as I said, was the annual mass drug administration. So it was done through preventive chemotherapy. And the mass drug administration basically involves administering an annual dose of medicine to entire at-risk population. Next slide. So WHO recommends the following drugs as MDA regime, which were given to the people. So the first one is albendazole, then is ivermectin, and the third one is DEC or diethyl carbamazine citrate. Next slide. Next slide. So from 2000 to 2020, 8.6 billion cumulative treatments were delivered to more than 925 million people at least once in 68 countries. And there were considerable reduction in transmission in many places. And the population requiring MDA has declined by 49%, where the infection prevalence have been reduced below elimination thresholds. Next slide. So the second pillar of the program was morbidity management. So it aims to provide access to an essential package of care for every person with associated chronic manifestations like hydrocele or elephantiasis in all the areas where the disease is present, and thus alleviating the suffering and promoting improvements in the quality of life. So it can be done with simple measures like maintaining hygiene, skin care, exercises, not rigorous exercises, but normal exercises, and elevation of affected limbs, and also by cleaning the affected area with soap and water and make it dry so as to avoid any secondary super infection. Then the next was vector control. Okay, so the next was vector control. So mosquito control is also a supplemental strategy which was supported by WHO, and it was used to reduce the transmission of not only lymphatic filariasis but other mosquito-borne infection. So depending on the parasite vector species, measures such as insecticide-treated nets, indoor residual spraying, and personal protection measures were taken. Next slide. So annual drug mass administration in India. So as I said, the global program to eliminate lymphatic filariasis was launched by WHO in 2000, but it was initiated by Government of India in 2004. So during this mass drug administration, there was single dose of DEC, that is diethyl carbamazine, and albendazole was given to all except pregnant women and children under 2 years of age for about 5 to 6 years to interrupt the transmission to in endemic areas, and each round of MDA was considered to be effective if at least 65% of the treatment coverage was accomplished. Ideally, it was 80%, but WHO accepts 65% treatment coverage is fine. Next slide. So after MDA, evidence for interruption of transmission was generated through implementation of task 1, that is through a survey known as transmission assessment survey 1, which was done among children aged 6 to 7 years in each district. And if the number of infected children found in task 1 is less than the threshold, that is 2% of antigen or antibody prevalence was there, then this MDA can be stopped. And after stopping MDA, post-MDA surveillance was initiated, which consists of 2 more rounds of tasks. And when all the districts in the country complete task 3 successfully, and a minimum package of care was delivered to all the patients who were suffering with chronic manifestation, then we can say that lymphatic filariasis is eliminated. So that's it. That was the last slide. Thank you.
Okay, any questions from the floor? Okay, so lymphatic filariasis is something that we should also have at the back of our heads, especially if it's endemic in the place that you are practicing or being a clinician. Okay, next group.
Uh, good afternoon, Doc. This is from Group 7, and in this talk, here we are discussing about the adolescent mental health problems.
Could you fix your audio?
Hello, hello.
Yeah, Subhojit, you are not audible. Your voice is creepy.
Fix your audio, please.
Is it audible now? Excuse me, Doc.
Hey, Subhojit, no. You can remove your earphones and you can try after that.
Okay. Give me 5 minutes, Doc. I'll try to fix this.
What?
Doctor, give me 5 minutes, please. I am trying to fix it.
Okay.
Excuse me, Doc. Am I audible now?
Okay, better go ahead.
Okay. This is Group 7, and today the topic is adolescent mental health problems. So, 1 in 6 people who are aged between the 10 to 19 years, which are the adolescent age group, it's a unique and formative time for physical, emotional, and social changes. It includes the which include exposure to poverty, abuse, or violence, and which can make the adolescents vulnerable to mental health problems. Protecting adolescents from adversity, promoting the social emotional learning, and the psychological well-being, and ensuring access to mental health care, and it is critical for the health and well-being during the adolescent and adulthood. Adolescents with mental health conditions are particularly vulnerable to social exclusion, discrimination, or different stigma, which can affecting their mental health and the educational difficulties, risk-taking behaviors, and physical health, ill health, and the human right violations. For the epidemiology, it's a mental health is a growing problem, especially in the adolescent age group. For more than 1 in 3 high school students who had experienced of persistent feelings of sadness or hopelessness in 2019, which has been increased 40% since 2009. In 2019, approximately 1 in 6 youth reported making a suicide plan in the past year, which is a 44% increase since 2009. Globally, 1 in 7 10 to 9-year old age group or the adolescent age group experiences of mental disorders, which accounts for 13% of the global burden of the disease in this age group. Next, the depression, anxiety, and the behavioral disorders it's, are the leading causes of illness and disability among the adolescents. The consequences of failing to address the adolescent mental health conditions, it extends to the adulthood, and it impairs both physical and mental health and limiting their opportunities to fulfill their life as adults. So the factor which can cause the mental health issues. Firstly, it could be genetically, then the trauma, such as the post-traumatic stress disorders, then environmental, then substance misuse, different drugs, puberty, negative thoughts, social pressure or the study pressure, and lastly, the identity crisis. This is the important cause of the mental health problems in adolescent age groups. So the adolescent is a crucial period for developing social and emotional habits, which is important for mental well-being. This includes the healthy sleep patterns, exercising regularly, developing the coping mechanisms like the coping with different difficult situations in that age group, then problem solving and interpersonal skills, learning to manage emotions. Lastly, the protective and supportive environments in the family, at school, and in the wider community is very important. Multiple factors which could affect the mental health. The more risk factors adolescents are exposed to, the greater the potential impact on their mental health occurs. Factors that can contribute to stress during adolescence, it includes the exposure to adversity, pressure to conform with peers, and exploration to identity. Media influence and gender norms, which can exacerbate the disparity between the adolescent lived reality and their perceptions or aspiration for the future. Other important determinants, it will include the quality of their home life and relationship with their peers. Violence, such as sexual violence and bullying, harsh parenting, and severe and socio-economic problems are recognized as a risk to mental health. Some adolescents they are at great risk of mental health conditions due to their living condition, like stigma and discrimination or exclusion, or lack of access to quality support and services.
which includes that is the adolescents who are living in a humanitarian and fragile settings, adolescents who are having chronic illnesses, then the autism spectrum disorders, and also an intellectual disability or other neurological conditions. Also, the pregnant adolescent or adolescent parents, adolescent from minority, ethnic, or sexual backgrounds, or other discriminated groups. Now, here we have showed some common mental health issues which is found in the adolescent age group. Firstly, the emotional disorders. Emotional disorder, it's a very common mental health issues found in the adolescent age groups. Firstly, there could be the anxiety disorders. It may involve the panic or excessive worry. It is the most prevalent mental health problem in this age group, and which is found in the older adolescent than the younger adolescents. It is estimated that the 3.6% up to 10 to 14 years old who are the younger adolescents, and 4 to 4.6% of the older adolescents may experience an anxiety disorders. Next is a depression, which is also falls into the emotional disorders. Depression is estimated to occur among 1.1% of adolescents who are 1.1% of the young adolescents and 2.8% of the older adolescents. Then depression and anxiety, it shares some of the same symptoms, including the rapid and unexpected changes in the mood. Anxiety and depressive order can profoundly affect their their school attendance and their school works. Social withdrawal, it can exacerbate the isolation and loneliness, and depression can lead to suicide. Next is the behavioral disorders. It is more common in the younger adolescent than the older adolescents. Attention deficit hyperactivity disorders, which is characterized by the difficulty paying attention, excessive activity, and acting without regard of any consequences. It occurs among the 3.1% of population of younger adolescents and 2.4% of the older adolescents. Conduct disorders, it involves symptoms of destructive or challenging behavior. It occurs 3.6% of the younger adolescent, while 2.4% for the older adolescents. Behavioral disorders, it can affect the adolescent education and conduct the disorders that may result in criminal behavior. Next, eating disorders. It includes such as anorexia nervosa and the bulimia nervosa. It commonly emerges during the adolescent age period. It involves the abnormal eating behavior and preoccupation with food, and accompanied in most instances by concern about body weight and shape. Anorexia nervosa, it can lead to premature death. It's often due to the medical condition, and it has higher mortality than any mental disorders. Next is a psychosis. Psychosis is a term, it is used to describe when people lose some contact with reality. It can be caused by a mental or psychological problem, a general medical condition, or alcohol or drug misuse. Condition that include psychosis most commonly emerge in the late adolescent periods. Symptoms that can include hallucinations or delusions, and these experiences can impair adolescents' ability to participate in daily life and also in the educations, often stigma or the human rights violations. Lastly, there is suicide and self-harm. Suicide is the fourth leading cause of death in the older adolescents aged between 15 to 19 years. Risk factors for suicides are multifaceted, like it includes harmful use of alcohol, abuse in childhood, stigma against help seeking, barriers to accessing care, and access means to suicide. Digital media, it can play a significant role in either enhancing or weakening the suicide prevention efforts. Then the risk-taking behaviors, it is most crucial in the adolescent age period. Many risk-taking behaviors such as substance use or the sexual risk-taking, or it starts during the adolescent age period. It can be unhelpful strategy to cope with emotional difficulties, and it can severely impact an adolescent mental and physical well-being. Worldwide, the prevalence of heavy episodic drinking among adolescents aged between 15 to 19 years, it was 13.6% in 2016, where the males are at most risk. Many smokers had their first cigarette prior to the age of 18 years. Cannabis is the most used drug among the young people, with about 4.7% of 15 to 16-year-old adolescent groups. Perpetration of violence is a risk-taking behavior that can increase the likelihood of low educational attainment, injury, and involvement with crime or death. Interpersonal violence, it was also ranked among the leading cause of death of the older adolescent boy in 2019. Now, now we are discussing about the promotion and prevention of this mental health problems. So mental health promotion and prevention intervention, it aims to strengthen an individual's capacity to regulate their emotions, enhance alternatives to the risk-taking behaviors, and it also builds resilience for managing difficult situation and adversity, and promote supportive and social environments. This program, it requires a multi-level approach with varied delivery platforms, for example, digital media, health or social care settings, schools or the community, and various strategies to reach the adolescent, particularly to the most vulnerable category peoples. Now, the early detection and treatment. It is very crucial to address the needs of adolescents with the mental health conditions. Firstly, avoiding the institutionalization and over medicalizations, whereas prioritizing the non-pharmacological approaches and respecting the human rights instrument are the key for the treatment of adolescent mental health problems. The critical supports and services, it need to be comprehensive and community-wide. Now, here we have discussed only the non-medical approach, which it can be helpful for the adolescent age group mental health problems. First, what schools can do, that they can provide a safe and supportive environment, whether in person or virtually, which is critical to students. Then linking the students to the mental health services whenever it is needed. Then integrating the social emotional learning, increasing the training staff, then reviewing the discipline policies to ensure the equity among all students, and the building safe and supportive environments. Next, what parents and families can do. First, they can communicate openly and honestly, including about their values, supervise their behavior, and facilitate healthy decision making. They can spend time with them and enjoying the shared activities. They can become engaged in school activities and help with their homeworks. And they can also communicate regularly with teachers and their administrators. Lastly, what the healthcare providers can do. They can ask adolescents about family relationships and school experiences as a part of routine health screenings. They can also encourage the positive parenting practices. They can engage parents in discussion about how to connect with their adolescents, communicate effectively, and monitor activities and health behaviors. Lastly, they can educate parents and youth about the adolescent development and the health risks. That's all, doctor.
Okay, any questions from the floor? Okay. One of the critical areas, and if it is not addressed, would translate. Good afternoon. Good afternoon, Dr. El Rey.
Good afternoon, ma'am. Good afternoon, everyone.
Okay. Adolescent issues, if not addressed, would translate into problems as you turn into adulthood. And it would be a critical stage to intervene such that you become productive adults eventually. But if already you will see the pathology and it is not addressed, then you will have difficulties coping later in life. And mental health issues of adolescents, sometimes you will say, you could easily dismiss it. But remember, adolescents are the ones who face pressure and in school, and if they some cultures, if they fail to succeed, some will commit suicide. So rates for adolescent suicide is quite high for some countries. So these are issues that needs to be addressed. Doc El Rey?
Yes. So there are a lot of issues in this very crucial stage of our life, and there are certain factors or say determinants that would actually give also an impact to our adolescents. It's not just the family, it's not just the peer pressure, but this day, even the social media. No? 10, 20 years ago, we don't have much of this internet or information technology. But we are seeing now that people are so engaged with social media. And that has an implication to the development of the whole being of a particular person, particularly our adolescents. So they are now exposed to this kind of cyberbullying. They are exposed to some sort of prejudice, no? So we need to be also, as future doctors, we need also to be relevant to whatever changing that's happened to our society, particularly to our people. Okay, and we need to also be adaptable to all of these changes. Okay.
Okay, next group.
Good morning, doctor. This is group 8, and we will do the topic mental health and mental illnesses. Group 7 did mental health in adolescents, but we are taking mental illnesses as a whole. So Chaitanya will proceed with the presentation.
Am I audible, Siddharth? Hello everyone. Let's go with anxiety. Anxiety is a general state of dread or uneasiness that occurs in response to a vague or imagined danger. Types of anxiety disorders: phobic disorders, panic disorders, generalized anxiety disorders, or obsessive compulsive disorder, or stress disorder. When it comes to phobic disorders, fear leads to avoidance behavior that interferes with one's life. Like any object or situation can become a phobia. Simple phobia. Yeah. Simple phobia. One second. A simple phobia, persistent, excessive, or irrational fear of a particular object or situation. When it comes to social phobia, the persistent fear of social situations closely for scrutiny. When it comes to panic disorder, frequent panic attacks that are unrelated to specific situations, like panic attacks, sudden onset of intense fear, like sweating, nausea, feelings of choking, trembling, shortness of breath. With agoraphobia, anxiety about being in like situation in which it would be difficult, like to escape if a panic attack occurred. When it comes to generalized anxiety disorder, an excessive or unrealistic worry about life circumstances that lasts for at least 6 months. Most common anxiety disorder, like typical onset is during adolescence and tends to be chronic. When it comes to obsessive compulsive disorder, Obsessive compulsive disorder is a persistent and uncontrollable thoughts or obsessions accompanied by the need to repeatedly perform rituals or the compulsions which makes him obsessions is intrusive and recurring thoughts or images. Individuals with OCD often recognize that their behavior is abnormal and are apprehensive about it. When it comes to stress disorders, I think Siddharth, is this continuing for someone?
Yes, I can hear you. Continue.
Okay. Stress disorders, post-traumatic stress disorder, it is an intense, persistent feeling of anxiety that are caused by a traumatic experience. PTSD may last for months or years. So when it comes to the symptoms, it is nightmares or flashbacks or avoidance of situations that bring back the trauma, heightened reactivity to the stimuli. So this is the treatment for anxiety disorder treatment, like prescription of medicines like antidepressants, SSRIs, SNRIs, and like therapies with CBT and talk therapy. You have alternative things like taking herbs and supplements like meditation, acupuncture, or aromatherapy. So for the lifestyle changes, you need to have proper sleep, healthy diet, exercising, or joining a support group and avoiding smoking. Specific phobias. This is the diagnostic criteria based on DSM-5. A persistent fear that is excessive or unreasonable that occurs by the presence or anticipation of a specific object or situation. Exposure to the feared item or situation almost always leads to an immediate anxiety response, which may take the form of a panic attack. The person recognizes that the fear is excessive or out of proportion to the actual threat posed. In children, this feature may be absent. The phobic situations is avoided or else is endued with intense anxiety or distress. So the avoidance, anxious anticipation, or distress during the feared situation interferes significantly with the person's normal routine, work, or school life functioning. The fear is persistent, typically lasting for at least 6 months. Anxiety, panic attacks, or avoidance associated with a specific object or situation are not better accounted for by another mental disorder. So now you have the types of specific phobia. These are 5 different types. One is animal type, natural environment type, blood injection injury type, situational type, and other types. When it comes to social anxiety disorder is also called a social phobia, is a long-term and overwhelming fear of social situations. A feeling of shyness or discomfort in certain situations, like when meeting a group of people, unnecessary signs of social anxiety disorder, particularly in children. Comfort levels in social situations vary depending on personality traits and life experiences. In contrast to everyday nervousness, social anxiety disorder includes fear, anxiety, and avoidance that interfere with relationships, daily routines, work, school, or other activities. So, when it comes to emotional and behavioral symptoms, your fear of situations in which you may be judged negatively, intense fear of interacting or talking with strangers. The physical symptoms is like blushing, fast heartbeat. So the treatment for specific phobia is cognitive behavioral therapy, a talking therapy designed to help individuals overcome problems with a tailored plan of action. When it comes to medication symptoms may be managed with tranquilizers, and also benzodiazepines, anti-anxiety drugs, and antidepressants. Hypnotherapy. Some individuals have found that it helps relieve symptoms of specific phobia. So, self help individuals may be able to manage the symptoms of their phobia through various self help methods. Depression and bipolar disorder. Depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. It is different from the mood fluctuations that people regularly experience as a part of life. There are many possible causes of depression, including faulty mood regulation by the brain, genetic vulnerability, and stressful life events. A report released by the WHO World Health Organization has estimated that the overall prevalence of depression in the Philippines is 3.3% till the report of 2017. The population-based study from India to report on depression shows that the prevalence of depression was 15.1% in 2020. Depression is a common illness worldwide with an estimated of 3.8% of population affected, including 5% among adults and 5.7% among adults older than 60 years. Policies and laws regarding depression by Philippines government, the Department of Health Administrative Order number 8 series of 2001, the National Mental Health Policy, and the Department of Health Administrative Order number 2016 or 0039 revised operational framework for a comprehensive national mental health program. Republic Act number 11036, mental health. So when it comes to bipolar disorder, the bipolar disorders are described by the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Health Disorders as a group of brain disorders that cause extreme fluctuation in a person's mood, or also known as mood swings, energy, and ability to function. This order affects about 45 million people worldwide. Bipolar disorder can also include symptoms of both mania and depression. This is what's known as an episode with mixed features. People experiencing an episode with mixed features may feel extreme sadness, guilt, and worthlessness, while at the same experiencing high energy, racing thoughts, and speech and overactivity or being hyperactive. It is not uncommon during a mixed episode for a person to go from being exuberantly happy to be expressing suicidal thoughts in a matter of moments. So when it comes to depression, you have sadness of mood, loss of interest in pleasurable activities, fatigue, changes in appetite, sleep disturbance, feeling of guilt, reduced attention and concentration, suicidal ideations or tendencies, difficulty in making decisions. When it comes to mania, it's abnormal and persistently elevated expansion or irritable mood, inflated self-esteem, decreased need for sleep, distractibility, increased physical and mental health activity, over involvement in pleasurable behavior, and circumstantial and tangential speech. And this is the graph showing the age specific and specific prevalence of mental disorders in India. So when we come to the treatment, the primary treatments for bipolar disorders include medications and psychological counseling, psychotherapy to control symptoms, and also may include education and support groups. Like medication includes mood stabilizers, antipsychotics, antidepressant or antipsychotic, and anti-anxiety medications.
Eating disorders. What are eating disorders? Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. They may start with an obsession with food, body weight, or body shape. In severe cases, eating disorders can cause serious health consequences and may even result in death if left untreated. They can affect anyone, but are most prevalent among young women. Anorexia nervosa. It generally develops during adolescence or young adulthood and tends to affect more women than men. People with anorexia generally view themselves as overweight, even if they are dangerously underweight. They tend to constantly monitor their weight, avoid eating certain types of food, and severely restrict their calories. Common symptoms of anorexia nervosa include being considerably underweight compared with people of similar age and weight, very restricted eating food patterns, a heavy influence of body weight or perceived body shape on self-esteem, a distorted body image, including denial of being seriously underweight, etc. Bulimia nervosa. Nervosa is another well-known eating disorder. Like anorexia, bulimia tends to develop during adolescence and early adulthood and appear to be less common among men than women. People with bulimia frequently eat unusual large amounts of food in a specific period of time. Common symptoms of bulimia nervosa include recurrent episodes of binge eating with a feeling of lack of control, recurrent episodes of inappropriate purging behaviors to prevent weight gain, a self-esteem overly influenced by body shape and weight, a fear of gaining weight despite having a normal weight, etc. Binge eating disorder. Binge eating disorder is believed to be one of the most common eating disorders, especially in the United States. Individuals with this disorder have symptoms similar to those of bulimia or the binge eating subtype of anorexia. Common symptoms of binge eating disorder include eating large amounts of food rapidly, in secret and until comfortably full, despite not feeling hungry, feeling a lack of control during episodes of binge eating, feelings of distress such as shame, disgust, or guilt when thinking about the binge eating behaviors, etc. Pica. Pica is another eating disorder that involves eating things that are not considered food. Individuals with pica crave non-food substances such as ice, dirt, soil, chalk, soap, paper, hair, cloth, wool, pebbles, laundry detergent, or cornstarch. Pica can occur in adults as well as children and adolescents. They said this disorder is most frequently observed in children, pregnant women, and individuals with mental disabilities. Individuals with pica may be at increased risk of poisoning, infections, gut injuries, and nutritional deficiencies. Depending on the substance injected, pica may be fatal. Post-traumatic stress disorder. Post-traumatic stress disorder (PTSD) is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncomfortable thoughts about the event. Symptoms. Post-traumatic stress disorder symptoms may start within 1 month of a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms cause significant problems in social or work situations and in relationships. They can also interfere with your ability to go about your normal daily tasks. PTSD symptoms are generally grouped into four types: intrusive memories, avoidance, negative changes in thinking and mood, and changing in physical and emotional reactions. Symptoms can vary over time or vary from person to person. Intrusive memories, recurrent, unwanted, distracting memories of the traumatic event, reliving the traumatic event as if it were happening again, that is, flashbacks, upsetting dreams or nightmares about the traumatic event. Kinds of traumatic events. The most common events leading to development of PTSD include combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, an accident. Many other traumatic events also can lead to PTSD, such as fire, natural disorder, disaster, mugging, robbery, plane crash, torture, kidnapping, life threatening medical diagnosis, terrorist attack, and other extreme or life threatening events. Complications. Post traumatic stress disorder can disrupt your whole life, your job, your relationships, your health, and your enjoyment of everyday activity. Having PTSD may also increase your risk of other mental health problems such as depression and anxiety, issues with drugs or alcohol use, eating disorders, suicidal thoughts and actions.
Okay, so now we will proceed with personality disorders. Personality disorders are a class of mental disorders characterized by enduring maladaptive patterns of behavior, cognition, and inner experience, exhibited across many contexts and deviating from those accepted by individuals' culture. The specific personality disorders are grouped into the following three clusters: Cluster A, which is odd and eccentric disorders; Cluster B, which is dramatic, emotional, and erratic disorders; Cluster C, which is anxious and fearful disorders. Okay, so yeah, wait a second. Okay, so cluster A, the odd and eccentric cluster, it includes paranoid personality disorder, which is characterized by a pattern of irrational suspicion and mistrust of others. And then we have schizoid personality disorder. It is lack of interest and detachment from social relationships. And then we have schizotypal personality disorder, which is a pattern of extreme discomfort interacting with society and distorted cognition and perceptions. Then we move to cluster B, which is dramatic and unpredictable cluster. It includes antisocial personality disorder. Antisocial personality disorder includes disregard and violation for the right of others and lack of empathy. And then we have borderline personality disorder, and then we have histrionic personality disorder. This includes attention-seeking behaviors and excessive emotion and egocentrism. And then we have narcissistic personality disorder. And as the name suggests, the person thinks very highly of themselves, and personality disorder in which they have inflated opinion of themselves and they have intense need for admiration and attention of others. And then we move to cluster C, There's the anxious and fearful cluster. It includes avoidant personality disorder, dependent personality disorder, and OCD. And as the name suggests, avoidant personality disorders are pervasive feelings of social inhibition and inadequacy, extreme sensitivity to negative evaluations. And dependent personality disorders, as the name suggests, pervasive psychological need to be cared for by other people. And OCD, and we have already covered OCD before in this presentation. And then we move to psychotic disorders. Psychotic behaviors are a cluster of disorders characterized by hallucination and or loss of contact with reality. The symptoms include delusion and hallucinations, severely disorganized behavior, speech, and thought. Disorders include schizophrenia, delusion disorder, brief psychotic disorders, and shared psychotic disorders. Schizophrenia, a type of psychosis, a neurological disease that affects a person's perception, thinking, language, emotion, and social behavior. It affects 1% of the population. Complete recovery from schizophrenia is rare. We have four different types of schizophrenia. One is paranoid, one is catatonic, one is disorganized, and the other is undifferentiated. The paranoid would include delusion and persecution and grandeur. Catatonic would include excitement and stupor phases. Disorganized would include bizarre behavior, delusion, and hallucinations, and undifferentiated symptoms that don't clearly fit into the other types. So, prevalence of schizophrenia. Onset is early adulthood. Children who develop schizophrenia have abnormal emotional reactions very early, less positive and more negative effect. The exact cause of schizophrenia are unknown. Research suggests a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop this condition. Some people may be prone to schizophrenia, and a stressful or emotional life event might trigger a psychotic episode. Other psychotic disorders include delusional disorder, persistent belief contrary to reality, which is delusion. Uh, take note of this point. Delusions are also present in schizophrenia, but delusional disorder is when you have delusion without other symptoms of schizophrenia. The onset is between 40 and 49. Brief psychotic disorder. It involves delusion, hallucination, disorganized speech, and behavior which lasts less than 1 month. This is exactly what differentiates this from the other disorders. Then we have shared psychotic disorder. A person develops a delusion similar to that of a person with whom he or she shares a close relationship. Okay, so that was the explanation of the disorders. Now coming to the public health part of it. 10th October is the World Mental Health Day. And then the month of May is dedicated as the mental health awareness, which is our next month. And we hope we all make ourselves aware and other people around us aware about the mental health issues. Okay, so prevention. Primary prevention is stopping mental health problems before they even start. Secondary prevention, supporting those are at higher risk of experiencing mental health problems. And tertiary prevention, helping people living with mental health problems to stay well. National Mental Health Program, NMHP. The Government of India launched the National Mental Health Program in 1982, keeping in view the heavy burden of mental illness in the community and the absolute inadequacy of mental health care infrastructure in the country to deal with it. Three main components of NMHP include treatment of the mentally ill, rehabilitation, prevention and promotion of positive mental health. Thank you. This concludes our presentation.
Okay, thank you. Okay, you've discussed extensively disorders of all kinds, from eating to personality disorders. Okay. Any questions?
I have a question,
Yes,
Dr.
Dr. Ray.
Yes. How can you actually promote self-help, self-care, not just to your patients, but also among in our profession? Say you'll be doctor someday. How do you promote self-care?
So we can, as doctors, when a patient is very vulnerable to mental health disorders because they're already feeling very different kind of things because of their disorder. So we can counsel them, and we can, if not just ourselves, we can have a specialist, a psychiatrist, or a psychotherapist present at the hospital itself, so that after the patient is done with the consult with the doctor, he can move to the next phase and visit the psychiatrist before he leaves. That can actually really help.
Sidrat, my question is directed to our profession. How do you promote self-care among physicians? Okay, remember, at the end of the day, it's not just the patient. Doctors can also be patients at the end of the day, especially that we can also have a burnout or
Yes.
a struggle
Being a doctor
with
could
our
be
mental
very
health. So how
expensive
do
at
you
times.
promote that?
Okay, so however stressful our life may be because of our work, we have to take care of our health first of all, because our health will affect our mental health directly. So the first step is to take care of our health, and second is be in touch with other people whom you can talk to about, be in touch in other doctors, a group of doctors who you can talk to about it. If you're feeling down, if you feel anxious, you can talk about it with other doctors who can understand your work directly.
Okay, so see that self-care is also important among physicians. Okay, and by probably practicing also or having a balanced diet and working on a personal development, you're correct, engaging in also stress relief activities, and also maintaining a healthy relationships, not just within our family but also identifying our support system. Okay, because at the end of the day, doctors can also be patients, and we need to be grounded and also guarded our emotions, particularly in how we deal with our patient at our work. Okay? All right. So, any other question from the group?
There's none. Next group.
None. Next group. Thank you.
Good afternoon, doctors. We are from Group 9. Our topic is substance abuse, introduction to the harmful or hazardous use of active substances, including alcohol and illicit drugs. The use of psychoactive substances causes significant health and social problems for the people who use them and also for others in their families and communities. Substances of abuse includes alcohol, opiates, cocaine, amphetamines, hallucinogens, prescription, and over-the-counter drug abuse. Psychoactive substances uses poses a significant threat to the health, social, and economic aspects of families, communities, and nations. Globally, the prevalence of alcohol use disorder is significantly higher than the prevalence of drug use disorders. Next. According to the World Health Organization, 2002,
आदमी खत्म है ये तब हो कुछ नहीं तो ये बात
9% of the total burden of disease is due to use of
अब बाल लोग को पैसा दिए हो भाई तो वापस ना करें तो ठीक बा
Could the speaker unmute herself?
8.9% of the total burden of disease is due to use of psychoactive substances. Tobacco accounted for 4.1%, alcohol 4%, and illicit drugs 0.8% of the burden of disease. There are 2 billion alcohol users, 1.3 billion smokers, 185 million drug users.
5 to 250 million people, or 3.5% to 5.7% of world's population age 15 to 64 used other psychoactive substances such as cannabis, amphetamines, cocaine, opioids, and non-prescribed psychoactive prescription medications. Globally, cannabis is the most commonly used substance, 129 to 190 million people, followed by amphetamine type stimulants, then cocaine and opioids. People who inject drugs, psychoactive drugs for non-medical purposes, are at increased risk of HIV, hepatitis B, and hepatitis C. Symptoms. Substance use problems can arise as a result of acute intoxication, regular use, or dependence on from the way in which substances are used. It is possible for a person to have problems from all of these. Acute intoxication can occur as a result of a single episode of drug use. Intoxication is highly dependent on the type and dose of drug and is influenced by an individual's levels of tolerance and other factors. Problems may be ataxia, abnormal or incoordinated movements, vomiting, fever, and confusion, overdose and loss of consciousness, prone to accidents and injury, aggressive, unpredictable behavior and violence, unintended sex and unsafe sexual practices. Regular use. A variety of different problems can occur from using the psychoactive substances regularly, ranging from physical, mental, and social problems. Specific physical and mental health problems, tolerance. Person no longer responds to the drug in the way that person initially responded. Anxiety, depression, mood swings, irritability, criminal offenses, relationship problems, cognitive problems relating to memory or attention, difficulties with regular job or study. Dependent use. Dependence is usually associated with more frequent use of a substance and at higher doses than used previously. The problems arising from dependent use of a substance can be similar to those observed with regular use, but are more severe. Cravings, an increased desire to use, anxiety, irritability, gastrointestinal upsets, and sleep problems, increasingly dysfunctional in daily life, marked tolerance, criminal behavior, relationship breakdowns, difficulty stopping in spite of problems, possible withdrawal symptoms or abstinence, continued use despite evidence, the use of causing harms to the individual. Specific health problems due to individual substances like tobacco. It is a risk factor for a number of serious long-term health problems and increases the severity of diseases such as high blood pressure, diabetes, and asthma, chronic obstructive pulmonary diseases. Children exposed to secondhand tobacco smoke are at increased risk of health problems such as respiratory infections, allergies, and asthma. Pregnant women who smoke are at higher risk of miscarriage, premature labor, and having a low birth weight baby. Tobacco use is risk factor for cancers of lung, bladder, breast, mouth, throat, and esophagus. Alcohol. Alcohol use contributes to a wide range of diseases, health conditions, and high-risk behaviors, from mental disorders and road traffic injuries to liver diseases and unsafe sexual behavior. Alcohol consumption at unsafe levels is a major cause of premature illness, disability, and death, and wide range of social problems. Women who consume alcohol during pregnancy are at risk of having babies with birth defects, learning and behavioral difficulties, and impaired brain development, liver and pancreas diseases, cancers of the throat, mouth, and breast. Inhalants cover all volatile solvents or the liquids vaporizes to the gas. that can be inhaled or breathed in. The most commonly used volatile substances include petrol, solvents, glues, sprays, lacquers containing benzene, and glues or paint thinners containing toluene. The most common way they are used is to sniff them from a container, although some may breathe them through a plastic bag. The short-term effects includes nausea, vomiting, headaches, and diarrhea. High doses can cause slurred speech, disorientation, confusion, delusions, weakness, tremor, headaches, and visual hallucinations. Ultimately, use can cause coma or death from a heart failure. Thank you.
And now cannabis. The likelihood of death due to cannabis intoxication alone is very low, although combination with other drugs can result in overdose and death. Cannabis use is associated with numerous negative health consequences. Next, cocaine. Cocaine is a stimulating drug. There is a significant risk of toxic complications and sudden death, usually due to cocaine effects on the cardiovascular system. And next, opioids. Use of street or non-prescribed opioids like heroin and opium can cause many problems for users, particularly as they are generally injected or smoked, which can create future problems for the users. Next slide. Causes and risk factors. Some risk factors that can influence a child for later substance uses and other problems have their present during different developmental periods of life. Many risk factors are related and tend to cluster together. Following are the various risk factors. Smoking and drinking alcohol during pregnancy. Insecure attachment during the child's first year of the life. Lack of classroom structure in the school environment. Parental abuse and neglect. Parental substance use can also affect the child both directly and indirectly. And parental smoke in the home. Next slide. Associated with drug abuse, fear, mental illness can increase risk of drug abuse. Genetic factors also influence the person's vulnerability to addiction. Methods of substance use. Injected with a needle under the skin into the vein or the muscle. Smoked or inhaled through the mouth or nose, or inhaled by placing a bag over the head, and it's called bagging. Placed on mucous membrane such as inside the anus or vagina, the nose, or under the eyelid. Chewing, swallowed, or dissolved slowly into the mouth and rubbing into the skin. Diagnosis. In response to the overwhelming public health burdens associated with psychoactive substance users worldwide, who experts develop the alcohol, smoking, and substance involvement screening test, that is ASSIST. The ASSIST can be complete in about 5 to 10 minutes and can be incorporated into normal consultants at primary healthcare services. A list of substances such as tobacco products, alcohol, cannabis, cocaines, amphetamine type stimulation, sedatives, and sleeping pills like benzodiazepine and hallucinations, inhalants, opiates, and other drugs are included in the screening test. The ASSIST obtain information from persons about lifetime use of substance and associate problems over the last 3 months. Next slide. It can identify a range of problems associated with substance use, including active intoxication, regular use, dependent on high use, and injecting behavior. The ASSIST determines a risk score from each substance. The score obtained from each substance fall into lower or moderate or high risk category, which determines the most appropriate interventions of the level of use. Screening aims to detect health problems or risk factor at an early stage before they have caused severe diseases or other problems, and is a part of maintaining prevention practice activities in the healthcare system. Management of substance abuse incorporated many components as it describes several aspects of individual life. Addiction treatment must help the individual stop using maintaining a drug-free life, and achieve productive function in the family, at work, and in society. Patients require long-term and repeated episodes of care to achieve the ultimate goal of sustained assistance and recovery. Next. Principle of effective treatment should be: treatment varies depending on the type of drug and characteristics of the patient. Treatment needs to be readily available. Effective treatment must address the individual drug abuse and any associated medical, psychological, and social, occasional, and legal problems. Behavioral therapy includes individually, family, or group counseling are the most commonly used form of drug abuse treatment. Medications are an important element of treatment for many patients, such as alcohol, nicotine, heroin, and other products, especially when combined with counseling and other behavioral therapies. Several subgroups within the large population of individuals affected by the drug use disorders such as adolescents, women, pregnant women, people with medical and psychiatric comorbidities, sex workers, and socially marginalized individuals. Prisons often require targeted and specialized care. An individual treatment and service plan must be accessed continuously and modified as necessary to ensure that it meets his or her changing needs. The appropriate duration of treatment for an individual depending on the type of degree of the patient problems needs. Usually recovered from drug addiction is a long-term process and frequently requires multiple episodes of treatment. Next slide.
Complications. The damage caused by substance abuse depends on the type of drug abused and the duration of abuse. The following factors also influence the severity of the problems that follow drug abuse. Age. The damage is greater among adolescents as well as those who are above 50 years of age. Nutrition status and living conditions. Poor quality and inadequate quantity of food, unhygienic living conditions, and poor access to healthcare increase the problems caused by drug abuse. Health conditions prior to abuse. The damage is less among individuals whose physical condition is good, as compared to individuals whose health was poor even before the onset of addiction. Genetic loading factor. A family history of specific medical and or psychiatric problem makes the individual more susceptible to the same problems in comparison to another drug abusers who is not genetically prone to the disorder. Medical and psychiatric complications due to substance abuse, problems due to intoxications, trauma or other physical injury, mood changes caused by drugs reduce inhibition as well as increase negative feelings leading to violence. Driving vehicles or operating machinery under the influence of alcohol, drugs causes accidents and injury. Poor judgment and poor coordination can cause physical injury or even death. Perceptual distortion can also result in accidents. Acute intoxication reactions, coma, and overdose deaths. Problems due to withdrawal. Physical withdrawal symptoms of varying intensity occur as part of withdrawal. Psychiatric disorders associated with substance abuse. Psychoactive substance can induce psychotic disorders during or immediately after uses such as cannabis. Systemic disorders associated with substance abuse. Cardiovascular complications, infection in the heart, blocking circulations, repeated injection at the same site can cause blood clots or air bubbles. Ventricular fibrillations. This may lead to hemorrhage and sudden death. Pulmonary complications, embolus formation, pulmonary edema, aspiration pneumonia. Hepatic complications, hepatitis. Hepatitis like hepatitis B, C, and D are bloodborne infections that can be transmitted through sharing of needles. Alcoholic hepatitis, fatty liver, alcoholic cirrhosis. Gastrointestinal disorders, gastritis, inflammation of the lining of the stomach, and peptic ulcers can develop due to poor food habits as well as due to the effect of drugs abused. Acute and chronic pancreatitis. The incidence of cancer all along the gastrointestinal tract from the mouth to the anus is higher among alcoholics. Neuromuscular complications, cerebrovascular accidents, dementia, neuritis, bacterial meningitis, cancer. As most drug and alcohol abusers also abuse tobacco products, the risk of cancer is high. Preventions. The family is the strongest factor in protecting children from drug use and other risky behaviors. School can cultivate sound values in their students in relation to health and drug use through the development of knowledge and providing them with the coping skills to face situations which can lead to drug abuse. Raising awareness of drug driving and its impact on road safety, including deaths, injuries, property damage, and harm to other road users among the general public. To take effective and practical primary prevention measures that protect people, in particular children and youth, from drug use initiation. By providing them with accurate information about the risk of drug abuse, by developing supportive parenting and healthy social environments, and by promoting skills and opportunities to choose healthy lifestyle, and by ensuring equal access to education and vocational training. National programs related to prevention of substance abuse, Ministry of Health and Family Welfare, and Ministry of Social Justice and Empowerment, Government of India are involved with alcohol and drug demand reduction policies and drug de-addiction programs in the country. The center at All India Institute of Medical Science, Delhi, has been designated as the National Drug Dependence Treatment Center and functions as the resource center for the DDAP of Ministry of Health and Family Welfare. Various e-health web-based programs related to the prevention of substance abuse, such as alcohol e-health operated by NDDTC, AIMS, Delhi, and M cessation program for tobacco cessation have been initiated by Ministry of Health and Family Welfare. The Narcotics Control Bureau, Ministry of Home Affairs, functions as an enforced agency for NDPS Act. Thank you.
Okay, any questions from the floor? Right, you're assigned two questions. Okay, could I request that we finish it next week? We'll finish all next week because Dr. Elre and I would have class with the clerks. Is that okay with you? We could start earlier next week so that we have more time. Sorry for today. I had an emergency. Okay?
Okay, doctor.
All right, thank you. So you may leave this call.
Thank you, doctor. We'll send you the attendance.
Okay, and for those, every group send the PowerPoint presentation and send your peer evaluation. Okay, so you may leave this call. Thank you.